Americans have made great sacrifices to slow the spread. Healthcare workers have demonstrated incredible dedication, and American businesses have stepped up. And every state in this country now is open. Parents have been the unsung heroes in this pandemic. I am so proud of the mothers and fathers who wore multiple hats and took on the enormous role of educating their children during this pandemic. And I'm really proud of the kids who were patient with their parents. You know, I've heard many stories, though, from parents who shared their struggles with me. This was not an easy time for parents. They had to become teachers and tutors overnight, and a lot of them were still working from home, sharing the computer with their children. And I know you all in this room, you understand better than most that our children made a lot of sacrifices during the past 3 or 4 months. They gave up playing sports, participating in other extracurricular activities. They missed out on field trips, prom, sharing moments with their friends. Most students had to say goodbye to their classmates virtually because we all thought we would be back. And they had to receive their diplomas in the mail instead of a graduation ceremony. We had a graduation ceremony at our house with just 4 of us for our daughter. So now, as the country reopens, many parents are returning to their offices to work. But if schools remain closed in the fall, we know this decision will have a tremendous impact on families. Sally Goza, where are you? We're so glad that you're here today. Sally is the president of the American Academy of Pediatrics. Thank you so much for your leadership on this. You are playing such a key role. But they released a statement, and I'm going to read your statement, Sally. The American Academy of Pediatrics strongly advocates that all policy consideration for the coming school year should start with a goal of having students physically present in school. As a teacher in an elementary school, I understand the benefits of having the students back in the classroom, but I will tell you, my school, we are changing a lot of things in the way we're going to do them in the fall. I was on a conference call this morning talking about students having their own art supplies this year. We're not sharing like we normally do. I'm not going to be teaching from my art room this year. I'm going to be going class to class. There are a lot of things we can do to make our schools safe. We know the value of in-person learning. It's well documented, and there's evidence of the negative impacts on children because of school closures this past spring. We don't want our children to fall behind academically. And returning to the classrooms will help our students get back on track academically. But in addition to achieving well academically, we know that schools offer our children an opportunity to strengthen their social skills. And research shows that lengthy time away from school can impact a student's mental and emotional well-being. And for me, being away from my students has affected me that way. I miss my kids. I miss them. So as we continue the conversation about reopening our country, we must not leave out our schools. Thank you so much to all of you for being here, and thank you for your strong leadership on this important issue. I'm actually headed to another event right now, so I won't be staying with you. We're launching today a public health campaign for our veterans. It's called REACH, And the president asked me to be the lead ambassador for Prevents about 4 months ago, which is the president's roadmap to empower veterans to end a national tragedy of suicide. We need to take care of our vets, but we need to take care of our kids. And right now is the time to recognize that we want to prevent these emotional, mental health challenges that our kids will face if they don't get back into school. So now I'd like to invite Secretary Alex Azar, Secretary Betsy DeVos, and Ambassador Deborah Birx to the front of the room to begin the first panel. And I look forward to seeing you all this afternoon at 3 o'clock. Thank you so much.
Thank you, Mrs. Pence. Thank you all for coming today. I just want to open by really thanking those who have been helping me from the very beginning. The president and vice president very early on recognized the trauma this was having to our children and asked me immediately to check in weekly with the American Academy of Pediatrics and the American College of Obstetrics and Gynecology, really to ensure that babies were born healthy, and then the American Academy of Pediatrics raising their concerns that we could take back to the task force. And I want to thank you for all those early morning calls where many people, I don't know what time zone they were in, but they were early for me, so they may have been very early for them. And I think from the very beginning, they wanted to raise the awareness of the whole child, where COVID-19 was one part of the analysis, but not the complete analysis, where we would look past the one dimension of COVID and public health to the multidimensional lives of children and their families for emotional, physical, and really comprehensive health that really occurs oftentimes within the setting of our school systems. So it's really my pleasure to have Secretary Azar and Secretary DeVos, who through this entire stress of the last 5 or 6 months have been focused on this particular area. So I want to give them a moment to give their opening comments, and then I have some questions for them that hopefully also reflect the questions that you have for them. Secretary Azar.
Great. Well, thank you very much, Ambassador Birx. So thanks to what Ambassador Birx, President Trump, Vice President Pence have done over the last 6 months through this historic response to this unprecedented pandemic, we have the tools to get back to work, back to school, and back to healthcare. So we're talking about the middle one today, which is we can get back to school. We can do so safely if we all think smart, if we accept our individual responsibility and our collective responsibility to act within a smart framework. And the Second Lady actually talked about a couple of the things that we can do to be back at school safely. And I'll talk first K through 12, because we've put out CDC guidance that can be of assistance to our states and our local leaders in reopening. And along those lines, I want to emphasize something the Vice President said to our nation's governors just a couple minutes ago, emphasizing a point that Dr. Redfield, our CDC director, made. Our CDC guidance is guidance. When it comes to reopening our schools, nobody should hide behind CDC's guidance as a way to not reopen schools. Our guidance is to enable and empower the reopening of schools and physical attendance by our kids. So as you think about K through 12, though, just think about the core elements of the Surgeon General's prescription for healthcare. First, what's your individual circumstance? Are you or a family member someone you live with particularly vulnerable at risk, and take appropriate action accordingly? Second, what's going on in your community? Are you in a community that has large-scale spreading of disease, or is it relatively isolated? Third, what's the type of activity that you're contemplating? And that, so is the school activities. How do you think through that? And then there are 3 core things that everybody should be doing. First, social distance. Maintain appropriate distance among the kids and with staff and faculty. Second, wear facial coverings when you can't appropriately social distance. Of course, we're socially distanced here. We've all been tested. It's a very different circumstance than our normal lives. But wear facial covering when you can't social distance. And frankly, in a school setting or anything crowded like going to a grocery store, wear facial covering because you're not going to be able to ensure social distance in that setting. Third, practice good personal hygiene. I know it's tough with kids, but it'll be a good lesson. And if you do those three things, then it's just smart practice. So setting up the desks in the classroom in a way that has appropriate social distance. As the second lady said, have the teachers rotate rather than the kids. Avoid congregate settings like auditoriums, assemblies, cafeterias. Have individual meals brought into the kids, stagger classes, what have you, to just avoid those collections. It's not going to be the full experience. It's not going to be the recess experience that's also really vital to kids, but it's something, it's physical. And as the American Academy of Pediatrics has said, there's an emotional, mental health, physical, and intellectual development toll that happens from our kids not being back at school. And then as we think about colleges and universities, we have to get them back up and running again. And there are ways that you can do that, the same types of tactics there. And I encourage our university leaders, I've got a kid in college, so I get to see both high school and college right now. Think about unintended consequences also. And this isn't the health secretary or CDC making an official recommendation, but I see a lot of universities talking about restricting the number of kids that can be on campus. Okay, well, that might make sense from a social distancing perspective, but do think about the other side of the coin, which is if those kids are just going to be getting houses or apartments in the same school community and, quote, distance learning instead of showing up in class, but then doing all the socializing and interacting without social distance and without facial coverings that you, the university administrators, now don't have control over because they're off campus, be thinking through those dimensions. You see a lot of unintended consequences from very well-meaning actions and plans. We've got a lot of tools that we've built, testing, surveillance tools that you can use to get reopened, to keep kids, keep faculty, keep staff safe. But we must reopen. We've got to get people back to work, back to school, back to health care, because we can't stay locked in our homes forever. It's bad for our physical and mental and emotional health, us as adults, as well as for our kids. So thank you, Ambassador.
Thank you, Mr. Secretary. Madam Secretary DeVos.
Thank you so much, Dr. Birx and Secretary Azar, and thank you both for your continued solid leadership on the task force as we have navigated these last few months. I'm really honored to be here with so many school leaders who have been thinking and planning today for how to ensure students can be back in school in the fall, and especially appreciative of Secretary Azar's comments about thinking practically about the implications of not having students back together in a learning environment. Our expectation should be that they will be. And there has been a lot of guidance written, a lot of practical thought given to how this can happen, acknowledging that every state and many regions within states are different and have different circumstances and may require different solutions. But I am constantly amazed and gratified by the ingenuity and creativity that the American people show when faced with a difficult situation. And we know today that there were too many kids who didn't have the opportunity to continue learning these past several months. I've spoken with every state school leader at least once, most of them more than once, and they said within their state there were a number of districts that learned how to do it well and pivoted quickly to a distance learning environment, and there were others who frankly just gave up and didn't expect anything, and that's just not an acceptable solution going forward. So when we talk about schools being fully operational and fully functional again in the fall, we can also acknowledge that in some places where there might be a flare-up, it might look different for a period of time, and we can that would be okay. We can plan for that. But our expectation should be that students can be back together in the fall, whether it's on K-12 campuses or in higher ed environments as well. And I want to especially thank again the American Academy of Pediatrics also for their thoughtful approach to this, because we know that for so many students, the school environment is the best place for them to be, and they have got to continue to develop themselves and not go through another several months to a year of really sort of biding time. So I'm looking forward to our conversation today about how we go with the expectation of students continuing their learning, and looking forward to all of the expertise here in this room. I also want to just give a little shout out to the State Commissioner Richard Corcoran in Florida, who just released a plan yesterday, which is very comprehensive in nature, and there may be other states and other communities that want to look at that. But again, with the expectation that students are together and that families will be able to count on a 5-day school week if that's the right answer for them. So looking forward to our conversation. Thank you, Dr. Burks.
Great. I'm going to ask the secretaries some questions. I just have to stop for a minute and recognize I have two incredible daughters who have been home with 2 grandchildren, and they have what I think sometimes we underestimate children's ability to adapt and understand the situation when they go back to school. Because I was struck by you saying they may not know the hand washing and the personal hygiene. My 2.5-year-old knows pandemics now and germs and how germs are transmitted, and knows the importance now of washing our hands, which we would have never spent any time on before. We just would have ignored that whole thing about hand washing. But the other thing that she's adapted to is the fact that grandma and grandpa can come over, wear masks, be 6 feet apart, and she knows that she cannot invade each other's space. And I think they can learn that also about each other out of respect for each other. Even 5-year-olds, if a 2.5-year-old can understand this. So it's amazing how they can follow rules when they're repeated. And I know every parent has been spending the last 4 months repeating that to their children in preparation for them to go back to school about what this really means. So, Mr. Secretary, you have amazing operating divisions that are able to look at all aspects of children, from mental health to physical health to intellectual health to development. Can you share your concerns based on all of that information coming into you about the benefits of being in school versus being in home for the child?
Yeah, and I don't want to preempt everything. I know Dr. Ellie McCants-Katz, who's our administrator of SAMHSA, the Substance Abuse Mental Health Services Agency, will be on the next panel. But schools are important and critical, not just for educating. They are actually the center of so many children's entire healthcare, mental health, social life. A great deal of nutritional support occurs in our schools. A great deal of our mental health counseling and support occurs in our schools. Most of our mandatory reporting for sex abuse or other types of on-child crime occurs in the school-based setting. And we lose all of that when they're not physically together in the school setting. So it's not just about the reading, writing, and arithmetic type learning. It's also the entire network that we have built around our children and the support system for them that exists only in that physical learning environment. And I'm sure Dr. McCants-Katz will talk in greater detail about some of the data that we have supporting how critical that setting is for kids.
Thank you, Mr. Secretary. I know that's what the Academy of Pediatrics brought to me at the very beginning, that both the telehealth, which we fought for pediatrics to be a part of, but also the fact how much the pediatrician and the school teacher all work together to really support the whole child, and how concerned the American Academy of Pediatrics was on the mental and emotional health of our children that may be in more vulnerable situations. And I think in the rush to just close things down. Everything was not completely considered in that moment about how we were going to protect our children. I know, Secretary DeVos, you've been working with school system after school system to really work on these best practices on how to keep learning going. And these would be the practices that a school for a short period of time could default to in a moment of a week or two if there was an outbreak. Could you talk a little bit about what you've seen about really what creativity people have brought to this?
Certainly. There were many, many schools and many districts that did an awesome job of pivoting from in-person learning to distance learning this spring. I'd like to highlight just a couple of them that I'm aware of. I'm sure there are many others, but in New York City, Success Academy, a chain of charter schools that serves tens of thousands of students, mostly vulnerable students, frankly, in their school population. And within a week, they had shifted to distance online learning and without really missing a beat at all. And it stood in stark contrast to some of their neighbors. A very good model for others to look at. Miami-Dade County, a large and diverse county. Many of you here in this room very familiar with the demographics and geography there. Miami-Dade had a really solid instructional support system that allowed for them to move to a virtual distance learning model and had extra interventional supports for those who needed that extra boost. Another very good model for folks to look at. The International Leadership Academy in Texas, they took the attitude that learning and instruction must continue no matter what the circumstances are, and they made a really impressive shift again to the distance learning opportunity. A couple of examples closer to home here to Washington. There's a couple of suburban districts here that didn't do a very good job, frankly, and I've heard firsthand from a lot of folks whose children are in those systems how disappointed they were with really the lack of effort and the lack of competence and focus around getting helping students to continue in a distance environment. And then there is another one here in suburban DC who is offering learning through summer sessions to all of their students this summer. So a very uneven application, but all that to say, again, our expectation should be that students, no matter whether they're hopefully in person, and that should be absolutely the goal for students to be able to be in person in school, but if whatever the circumstances dictate, require some distance for a while, if there's a flare-up of the virus in that particular school or in that classroom, that there are plans in place to be able to shift to immediately, and that can be done seamlessly. I've also heard of a lot of very creative thinking going into how to minimize the risk of students being together in the fall, and thinking about things like, where do you have choir and where do you have band? And I have heard a lot of discussion about thinking anew about learning outside as long as the weather is good, and putting up little temporary coverings or tents to be able to hold your choir classes or your band classes outdoors where you have a lot more fresh air. And I know the medical folks among us would probably say that's a good idea. But thinking about those sorts of situations in ways that are unique to your particular school or your particular community is an imperative for all of us.
Thank you. That was so well said. And I think part of the reason for this dialogue today was to really look past and within the first dimension of where we exist in COVID-19, but to bring together those other dimensions, not only the physical, specific health around COVID-19, but the emotional and mental, intellectual health. And I think, Mr. Secretary, you talked about that at the beginning, and we have brilliant people here sharing with us, and we'll be in that third panel. But how are you tackling kind of the risk-benefit relationships of all of these different factors? And is there a way that we can bring not only a whole of government, but a whole of thought process on the three dimensions of a child and what they need, rather than the unidimensional piece of COVID-19? And how are you thinking about that?
Well, and I think we see this not just in the school context with kids, but just generally, as we talked about work or healthcare. You know, in the healthcare setting, I've been trying to make it clear that too often we're talking about health versus reopening the economy. It's a balance between, are we going to have economic activity and healthcare, where I actually think it's health versus health. And so we're seeing kids not getting pediatric vaccinations. Millions of children are not getting pediatric vaccinations. People are not getting preventive screenings. They're not getting diagnosed for cancer. Hundreds of thousands of people are not getting diagnosed with cancer. People are literally not presenting in emergency rooms with stroke and heart attack. They didn't stop having strokes and heart attack. They're not presenting in the ER, where time is muscle and time is brain, and they need to get in. And the long-term, very real health consequences for adults and children of being locked down in your home are going to be with us for some time. And then you add the mental health issues for the kids. Children are social beings. We're all social beings, and we need to have that interaction. And we already have enough of denial of that through social media and everything else, and then we take away the physical side of it at school and those fora. And I think any one of us in this room can see in our own children the impact it has on them. In some respects, we're lucky being essential and having to go to work. We don't actually get to and have to feel all of that personally. That experience. It's important that we deal with the disease. Dr. Birx can talk more about, why we did the initial slow the spread. But that was because of a need to flatten and delay the curve of disease while we built up tools, health system, personal protective equipment, advanced on therapeutics and vaccines, learned how to deal with this disease. But now we have tools where we can manage through if we act responsibly. Acting responsibly, by the way, does not mean going to a very, very crowded bar in an outbreak area without facial covering. That would not be good individual responsibility. If we act with good individual responsibility, protecting ourselves, protecting those in our households, and protecting those that we interact with in normal society, there's no reason we can't do any of this. We have healthcare settings. We have healthcare workers. They don't get infected because they take appropriate precautions. They engage in social distancing. They wear facial covering. They use good personal hygiene. This can work. You can do all of this. There's no reason schools have to be in any way any different from the rest of what we need to do on opening ourselves up.
I think you made some just really terrific points. And you know what? I'm sure you all feel this, that what's happening today with our outbreaks across the South, where they didn't really experience March and April in the same way the Northeast did, the Mid-Atlantic and the Midwest. Yet their case fatality rates are very different than they were in March and April. And I think that's because of what you just described. It gave hospitals and clinicians the ability to learn how to do better care, and critically how to bring better therapeutics early on into the disease. And we've learned about the spectrum of disease, which frankly we didn't know when this started. All the data said about 17% were asymptomatic. We now know it's way over 50% for people under 30. And that means that they don't have any symptoms. And as we work through this and we get some antibody levels, we'll see precisely by age group who really has been exposed with no symptoms at all, and who we have to really worry about in a very clear way. And that allows us then to focus our resources on protecting those vulnerable teachers, those vulnerable administrators, while we continue to have children in school. And I know, Secretary DeVos, you've really thought about the importance of the in-school experience. And just as our last answer, if you could talk a little bit about why you personally believe it's so important for children to be in school and why we're holding this today to really emphasize that point.
Well, thanks, Dr. Burks. I think both you and Secretary Azar have articulated some of the important reasons, but as you've noted, children are social beings. We're all social beings, and not being able to be together with students of similar age groups and with friends over extended periods of times, it's unhealthy for anyone. And we've noted the fact that with everything in life, there is some level of risk. And it's a matter of assessing those risks and taking all the different factors into account. So not only physical health and safety, but also socio-emotional health and mental health, and also the opportunity that a school environment provides for all students, particularly the most vulnerable students and students with disabilities who really need to be in classroom settings, many of them, in order to continue to develop themselves as a person. And so it can't overstate the importance of the need for schools to be open again and for students to have that opportunity to learn together in person. And I would just encourage all those involved with those discussions to listen to the parents and listen to what their experiences have been and work together to find the right solution for your community and your schools, because it is imperative that students continue to learn.
Maybe you both could quickly, as our very concluding piece, what should really parents expect in all this? Because we haven't really talked about that. So Secretary Azar, what should parents expect and hold the counties accountable for, since it's their tax dollars that are going to support the schools? What should they expect schools to do for them? And then Secretary DeVos, same question.
Well, I think they should expect that the schools can deliver a safe learning environment for their kids, even when we're experiencing a pandemic of this sort. And that means taking the reasonable and appropriate precautions in the school to protect children, to have appropriate surveillance systems and appropriate social distancing, facial covering policies, enforcement of these, and good personal hygiene. And I don't think that's too much to expect. It's actually fairly basic common sense. All of this is very common sense if we just will live up to it. It doesn't have to be extreme. We can take a very reasonable course here, a balanced course. And that's what parents ought to expect, because those parents have to get back to the factory. They've got to get back to the job site. They've got to get back to the office. And part of that is their kids, knowing their kids are taken care of.
Secretary DeVos.
Well, I don't think I could express it any better than Secretary Azar has. I think that that's exactly what parents should expect. I also think I would just add that I think that adults demonstrating grit and determination and resilience is an important factor here, and it's important for kids to see. It's important for students to learn.
Thank you. If you could just join me in thanking this wonderful panel. It's a privilege to be here with all of you. And we're ready for the next panel.
Great. Thank you very much, Dr. Burks, for...
All right, folks, give me 1 second while I put the thing back up. I don't know why these idiots do this. I swear, they're so dumb. But give me a second here as I put the footage back on your screen. This is going to be, or we're going to start the second panel, as they said, in just a few moments. So just give me a second here. I'll put it back up on your screen. I don't know why they do this. How come they can't just leave it on? It makes absolutely no sense to me. And the other thing too is that nobody else is streaming this, which also doesn't make any sense to me.
And I'm pleased to be moderating this very distinguished panel. Before I introduce today's speakers, I'd like to take a few minutes to share some thoughts on the very critical topic of the reopening of our nation's schools. As the Assistant Secretary for Mental Health and Substance Use, I feel very strongly about the need to protect and promote the mental health of all Americans. However, I take particularly seriously the role of my agency and its work with respect to children. Perhaps never was there a time when this is more important than it is right now. The existence of a physical health crisis does not eliminate the need to address our citizens' mental health. Unfortunately, it actually only makes that need even greater. I lead the Substance Abuse and Mental Health Services Administration, or SAMHSA, which is the only federal agency whose primary charge is addressing mental and substance use disorders across the country. Where better to start in addressing these challenges than with our nation's young people? Protecting and also fostering the social and emotional well-being of children is critical not only to their own development, but also to the development of healthy families, communities, and a healthy and productive society. These children represent our nation's future, and the importance of that cannot be overstated. The work that schools and school personnel do daily is valuable beyond any words I can deliver. Our children spend most of their waking hours in your schools, in the care of your teachers, your administrators, your school personnel. Schools provide education, but also provide an important environment for social development, provide enhanced services for children with special needs, provide essential nutrition, and for many, provide health and mental health services. It is that school that provides children a safe place. Schools which have implemented positive behavioral environments have had exponential success with students. It is the school day, the school building, the school routine that provides kids with structure that is so desperately needed for their emotional development, their mental and their physical health. As we all know, in response to COVID-19, most schools throughout the country suspended in-person classes for the 2019-2020 school year. As reopening plans are considered for the fall, I understand the anxiety and, for some, the fear that this engenders. But I urge all to remember what drew them to an interest in being part of the educational system for our children, no matter the perspective you represent here today. For most, if not all of you, I'm certain it was a desire to shape the future of our young people, to provide them with knowledge and skills and training that would serve them their entire lives. Many of you have dedicated yourselves to that honorable cause. The role that schools play is integral to the healthy growth and development of children. The existence of coronavirus has not changed this integral role. Children need to interact with other children their age. They need to learn how to share, how to play, how to deal with conflicts, how to negotiate, how to persevere during difficult social situations. These lessons cannot be taught online. We must return our children back to the environments in which they thrive. I've kept in close contact with communities during this time, and I've heard that even for children in the safest of homes, with the ablest of parents of sufficient means, the one wish children have is that coronavirus will go away so life can get back to normal. If these are the musings of small children in safe and stable homes, I can only imagine what children who are not so lucky are thinking. One of the most disturbing things I recently heard was that New York City has had a 51% decrease in reports of child abuse and neglect. The knowledge that this 51% decrease in reporting was likely in no way accompanied by a 51% decrease in actual child abuse and neglect saddens me greatly. The role that educators, administrators, school counselors, and other school personnel serve as reporters and as an extra set of eyes and ears looking out for the well-being of our children is absolutely critical. With the closure of schools, we have removed that safety net for millions of children across our country. We cannot simply focus on virus containment at the expense of everything else. We must also remember that, thankfully, this virus does not appear to have a major impact on young people. The data tell us the vast majority of those that will have serious consequences from COVID-19 are over age 65. In no way am I diminishing the tragedies that have befallen some children or the severity of illness on our nation's elderly, but we must take into account these facts as we consider the consequences of not opening our schools. As you think through plans for the upcoming school year, please remember all aspects of health. Never has it been more critical to protect and promote mental health. Think about the effects of these past 3 months on yourselves as adults. It has caused all of us great fear, anxiety, stress, disruption to our routines, frustration, and often confusion. And we're adults with coping skills and tools to address these reactions. How are our children supposed to do this? The best we can do to answer that question is return them back to a familiar environment, a familiar social situation, the comfort and warmth of their teachers, their peers, and their school, the classroom that provides them both book and life knowledge. We've learned a lot about mitigation strategies like hygiene and social distancing, and how to implement these approaches to maintain safe environments. I understand these decisions are not easy. Again, the fear is also understandable. But let's not let our own fears hinder our children's ability to learn and grow and thrive. I, for one, am certain the education you provide, the environment schools create, and the skills they instill are indeed essential services that should be open and available to our country's young people. I recognize that many are considering the cost, non-monetary that is, of reopening, but we must also ask ourselves the cost of not doing so. In my opinion, that cost falls on our nation's young people, and it is simply a cost too great to bear. Thank you for the opportunity to share my thoughts. We have an excellent panel here for you today, and I know you will be very interested in hearing their thoughts as well. What I'm going to do is to introduce all three panelists first, and then I will ask each to begin by sharing their thoughts on school reopening. And I will start with Dr. Sally Goza, who is the president of the American Academy of Pediatrics. Dr. Goza is a general pediatrician and has had the privilege of taking care of children in her hometown of Fayetteville, Georgia, for over 30 years. She is a managing partner in First Georgia Physicians Group. She has been involved with the American Academy of Pediatrics Georgia chapter for over 20 years, including serving on the Board of Directors, Medicaid Task Force, and as chapter president. She is currently on the Legislative Committee, the Fall Planning Group, and the Board of Pediatric Foundation of Georgia. Dr. Goza was involved in the Hub and Spoke Quality Improvement Initiative and the development of the current American Academy of Pediatrics Strategic Plan. She represented the Academy at the Council for Medical Specialties Societies. Next, we have Dr. Lisa Piercy, who is the Commissioner of the Tennessee Department of Health, appointed in January of 2019. Dr. Piercy earned a bachelor's degree from Lipscomb University, a master's degree from Bethel University, and a Doctor of Medicine and Podiatrist residency training from East Tennessee University Quillen College of Medicine. Prior to serving as commissioner, she served as Executive Vice President of West Tennessee Healthcare. Dr. Piercy is certified by the American Board of Pediatrics in both general pediatrics and in the specialty field of child abuse pediatrics. And our third panelist is Dr. Robert Redfield, who is the Director of the Centers for Disease Control and Prevention. He has been a public health leader actively engaged in clinical research and clinical care of chronic human viral infections and infectious diseases, especially HIV, for more than 30 years. He served as the founding director of the Department of Retroviral Research within the U.S. military's HIV research program and retired after 20 years of service in the U.S. Army Medical Corps. Following his military service, he co-founded the University of Maryland's Institute of Human Virology with Dr. William Blattner and Dr. Robert C. Gallo, and served as the Chief of Infectious Diseases and Vice Chair of Medicine at the University of Maryland School of Medicine. I'd like to ask each of our guests to take a few minutes to introduce themselves and to discuss their approach to the issue of school reopening, and then we'll have some questions and answers. Dr. Goza, can we start with you?
Thank you.
I think if you just talk.
Thank you, Assistant Secretary McCants-Katz, and good afternoon. My name is Dr. Sally Goza. I'm a practicing pediatrician from Fayetteville, Georgia, and I'm president of the American Academy of Pediatrics. The AAP represents over 67,000 pediatricians across the United States. It's an honor to be here today to talk about how to do the best we can for our children in these challenging times. Thank you for fostering this important dialogue. Children get much more than just an education at school. Being away from peers, teachers, and school services has lasting effects for children. Because of this, the AAP carefully weighed the evidence and determined that our shared goal should be to have students physically present in school this fall, if at all possible. Even though this will not be easy, we strongly advocate that all policy considerations for the coming school year should start with this goal in mind. This should happen with careful measures to keep students, teachers, and staff safe, and with the flexibility to adapt as needed to the community's prevalence of COVID-19. Of course, returning to school must be done safely. It is important to make the school environment safe for all those in the building. School leaders and state and local public health officials will need to work together to ensure safety for children, teachers, and staff. We all will need to be nimble and flexible and ready to switch gears based on factors including each community's prevalence of COVID-19 cases. I will share some of the rationale that went into the Academy's thinking. First, we considered what we know about children and coronavirus. The evidence we have so far indicates that children and adolescents are less likely to have symptoms or severe disease resulting from SARS-CoV-2 infection. Studies so far have also shown that children are less likely to become infected and they are less likely to spread infection. COVID-19 appears to behave differently in children and adolescents when compared with other common respiratory viruses such as influenza and RSV. Second, we considered how crucially important physical presence in schools is for children. Students who are in school learn more than math, reading, and science. They also learn social and emotional skills, get healthy meals and exercise, mental health support, and other things that cannot be provided with online learning. Lengthy time away from school makes it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical abuse, substance use, depression, and suicidal ideation. It is also important to stay focused on considerations and accommodations to account for the diversity of youth. With the goal of safe return in mind, we must pay special attention to vulnerable populations, including those who are medically fragile, live in poverty, have developmental challenges, or have special health care needs or disabilities. It is also critical to reflect on the differential impact SARS-CoV-2 and the associated school closures have had on different races, ethnic, and vulnerable populations. This pandemic has been especially hard on families who rely on school lunches, have limited access to computers and the internet, or do not have access to health care. Schools play a critical role in addressing racial and social inequity, and we must keep that at the forefront of this discussion. Cloth face coverings, frequent hand washing, and cleaning should be implemented. Physical distancing is important, especially for adults, including teachers and staff. The Academy has also offered age-specific guidance on the physical distancing among students. Children absolutely must be up to date on all vaccines, and AAP recommends that all children are vaccinated for the flu and have had their physicals. Existing school immunization requirements should be maintained and not deferred in response to coronavirus. New measles outbreaks or flu can cause severe illness or be life-threatening and should not be taken lightly, especially in the midst of this pandemic. Decisions to alter the school schedule, such as partial days or alternate attendance days, or to temporarily close schools, must be made by local and state officials according to the prevalence of COVID-19 in the community. We believe the goal should be to have students physically present in school as long as safety measures for students and staff can be met. Schools should anticipate and be prepared to address a wide range of mental health needs, as we've been talking about, of children and staff when schools reopen. The emotional impact of the pandemic, including financial concerns, social isolation, and growing concerns about systemic racial inequity, coupled with prolonged limited access to critical school-based mental health services and the support and assistance of school professionals, demands careful attention and planning as well. Reopening schools in a way that maximizes safety, learning, and the well-being of children will clearly require new investments in our schools. We call on our leaders to provide the resources necessary to ensure that funding does not stand in the way of safely educating and caring for our children. Thank you for the opportunity to be here today, and we look forward to partnering with all of you.
Thanks very much, Dr. Goza. Dr. Piercy, would you say a few remarks?
Thank you, Dr. McCants-Katz, Dr. Redfield, Dr. Goza. On behalf of Governor Lee and myself and the state of Tennessee, we're very proud to be here and represent the approach that we're taking in Tennessee. And the overarching principle we're using is this virus isn't going to go away. We've got to learn to live with it. Our economy depends on it. And getting kids back into school is critical for our economy, and it's critical for their health. Because if you remember, education and economic prosperity are both key drivers of health outcomes. And so we see it as a health imperative, and particularly an economic imperative in Tennessee to get back to work and get kids back to school. So in order to do that, Department of Education and the Department of Health has really tried to offer a realistic and an executable and a boots-on-the-ground approach to how to do this. So in early June, we released a pretty comprehensive, about 44-page overview guide for school districts. And ever since then, we have continued to trickle out toolkits. And these toolkits contain very specific information on things like early childhood, transportation, mental health, the real nuts and bolts that school systems need in order to get back to work. And the other thing we've done that I think is very important as a pediatrician is we're looking at the holistic needs of the child. We've stood up a COVID-19 Child Wellbeing Task Force, and it has everybody from educators to health professionals, community leaders, legislators, nonprofits, coming together to see how can we implement this plan on a local level, how can we rapidly respond when there becomes an issue, and how can we provide ongoing support. We see this as a health imperative and an economic imperative, and in Tennessee, we're really trying to get our kids back to school as soon as possible.
Thanks very much. And Dr. Redfield?
How do I turn it on? I think you just talked. I just talked? Okay, yeah, that's good. Thank you. I'm technically challenged, so this one works for me. First, I want to thank you all for all that you do. Second, I just wanted to underscore that it's important to consider schools as a high priority setting within our communities, and they have a critical role. The local context and needs of schools are all unique, and as such, we need to tailor plans to reopen them in a way that minimizes the risk of COVID, while providing, obviously, the students the critical services and academic resources and social and emotional support that we've heard about that they need. CDC encourages all schools to do what they need to reopen and to have plans that anticipate that the COVID-19 cases will in fact occur. When I look at it, I think it's important that the guidance that we've put out, as the Secretary mentioned, is guidance. And I want people to see it as guidance to reopen. And nothing would cause me greater sadness than see any school district or school use our guidance as a reason not to reopen. And CDC is prepared to work with any school district or school to work through our guidance so that they can come up with their own unique plan to reopen. I think it's worth noting that CDC never recommended general school closure throughout this pandemic. We see schools, as has already been mentioned, as a vital part of our society, and we think as you measure the different risk, it's clear that we would see the greater risk to our society is to have these schools closed. So we want to work with you and work through so that parents and communities and teachers and you all have the confidence that we can reopen these schools safely. We've put out a variety of different strategies. We don't need to go through them now that people can support, whether it's schedule, class size, how you space seating, the use of barriers in the school to maintain social distancing, obviously closing shared and communal spaces, discouraging shared items, as you heard the second lady discuss with the art supply, posting signs to remind people. As Ambassador Burks mentioned, these young individuals can learn these skills very, very quickly. They're very astute to watching what we do. Obviously, we've done with disinfection and cleaning, making sure ventilation works properly. But the real goal here is to get these schools reopened and for the benefit of the students. We're in the process of providing more guidance and more what we call consideration documents in the next couple of weeks. One for preparing K through 12 communities to return to school safely. Another one for school decision-making tools for parents and caregivers. Another one for schools to be able to use for symptom screening consideration. Another one for schools on cloth face coverings in the school setting. And finally, monitoring evaluation. But in closing, I want to stress if there's other gaps for some type of guidance or consideration, that it would be of benefit for school districts to have. We see this as a bi-directional exchange. Please bring those to our attention so we can work to, because if you all feel that they would be of benefit, I guarantee you there's multiple other schools and school districts that would feel the same, so that we can continue to provide the necessary guidance to get our schools open and keep our schools open. Thank you very much.
Thanks very much, Dr. Redfield. I have a few questions that for our panelists, and I hope we'll have people feel free to elaborate on some of these issues. I'll start with you, Dr. Goza. The American Academy of Pediatrics has really come out quite strongly in favor of reopening schools and having students physically present in schools. I'm wondering if you can speak to an idea that has been put forward that virtual learning is as good. It can be as good as face-to-face learning, and what's the impact of students being out of school for long periods of time?
So we looked at that, and we looked at the social and emotional skills that children learn in school, and also just the fact that not all children are able to do the virtual school, the online school. Some people do not have internet. Some parents have to work, and so their children are in daycare, and they come home at night and try to do the schoolwork at 6 and 7 o'clock at night, which just doesn't work very well. I've had patients in my office that that's been the case. And some children, especially children that have attention issues, it's really hard to sit in front of a computer for a long time. We've done meetings, and about an hour is about all I can take, and I have to get up and move around and then get around, and it's very hard to pay attention. So we feel like that for a lot of children, the in-person school is better. There are some children who do wonderfully with online school. I mean, we have children in charter in the cyber academies who do fine, but we do feel like for the majority of children that interaction in-person school is better.
Thanks very much. And does the American Academy of Pediatrics also weigh in on the before and after school programs as well? Do you see the schools being a place where all of these programs can continue?
We have not weighed in on that, and so I will take that back to our school health experts and ask them to look at that as we go forward. Our guidance is updated at least every 30 days, so I'm sure we will be looking at that because that will probably be a question that gets asked of us many times.
Okay, all right. Dr. Redfield, I was wondering if you could say a little bit more about CDC's work in this area. CDC has really worked very hard to develop guidances in many areas to help Americans to safely resume many types of activities. I'm wondering if you can talk about how CDC can reassure Americans that it's safe to reopen schools.
Yeah, I think it's really important to emphasize, and I've said this before, we're not defenseless against this virus. We actually have very powerful weapons. And that is something as simple as staying 6 feet apart. This virus has a defect, it has a difficult going human to human, that distance. We have a second important defense mechanism, and that's facial coverings. And clearly you heard Ambassador Birx make the comment of how important it is for us now to really embrace facial coverings across the board. And the third, obviously, is to increase our practice of hand hygiene. These are powerful. We just looked at our household contact studies that we're doing at CDC, and it's very interesting. Those cases that were defined within a couple days, then went into a household study to see what happened in the households. And in the household studies that I looked at so far, those index cases that truly practiced those social distancing techniques that I just mentioned, while they were in the household with individuals who weren't infected, we didn't see transmission. But in those households that didn't, we saw over 75% of the individuals in those households become cases. So in this method of social distancing, face coverings and hand washing really does work. And I think it's important for everyone to understand that. So having that security that we're not defenseless against this pathogen while we're waiting for better countermeasures. So I think, and clearly understanding that implementing those strategies in a meaningful way in the school setting can really be done in a safe way. The most important thing that we need to focus on, it's a big point that Ambassador Birx has raised, is that we have to stay focused on protecting the vulnerable. Those individuals that have multiple medical conditions, those individuals that are elderly with multiple medical conditions, really need to look at making sure that we continue vigilance in protecting them from the potential of infection.
Thanks very much, Dr. Redfield. Dr. Piercy, I'd like to ask you about what Tennessee has been doing to prepare for school reopenings. If you could speak in maybe a little more detail, as I think that could be really helpful to those that are starting to think through those issues for themselves. Elementary, middle, and high schools, all different, and I'm wondering, what kind of guidance has the state offered to your communities, and who have you brought to the table to come up with the plan that you have?
Sure, those are great questions and questions that we're thinking about every day. As you mentioned very astutely, there are different needs based on different ages of children. And even going down to early childhood, it's pretty unlikely that a preschooler is going to keep a facial covering on. So what can we do in order to mitigate the spread in those early childhood classrooms? Compare that to older children, middle schoolers and high schoolers, who would tolerate that better and could be more compliant. But it's not only about that behavior in our children, but it's about setting up the physical environment. So in Tennessee, the Department of Education, the Department of Health has tried to offer both broad conceptual guidance as well as concrete practical tips. Even things that are incredibly useful and easy to do, like making 90-second videos for teachers to say, if your classroom looks like this is how you should set it up. Or this is how you get kids to go in the same direction in narrow spaces. And so very practical tips that our teachers can use. The other thing that we have done and we feel is really important is making sure that our schools are adequately equipped. And it takes a lot of hand sanitizer. It takes a lot of soap and water. It takes a lot of personal protective equipment for school nurses. We're leveraging our EMA agency in order to be able to provide for those needs for schools so they can safely reopen. And more than anything, providing actual education on the disease, but also on how to rapidly identify and mitigate any cases that will inevitably pop up. And that also takes into consideration setting appropriate expectations for parents and for teachers and for staff. Because with the enhanced vigilance of all of the different factors of parents, when they think that their child is at risk, they may take extreme measures. And so if they hear of a first case in the school, what we don't want to do is them to immediately take their child out of school, because that's not what is best for that child and the holistic needs of that child. So setting expectations for parents and educating them on, we have a plan for what happens, and we have a stepwise approach that we want to take in order to maximize the learning potential for those kids.
Great, thanks very much. Dr. Goza, I wanted to ask you about what you think pediatricians can do to help with this process of speaking with parents, with families, with schools, administrators. How can pediatricians help with this?
So I will tell you, our guidance came out based on the fact that we had many pediatricians calling us saying, we need to know what to tell parents about school. And we need to know how to talk to them about this, and we need to be able to work with our counties and our school systems, because we want to be at the table as they decide how we're going to do this and how we're going to do it safely, so that children and teachers and staff are all protected as they go back to school. And just about the realistic expectations of the, we may start back in school and we may have to change gears as we get into school if the prevalence increases in your community. So we have a campaign out, Call Your Pediatrician, and I tell people, if your parents have questions about whether they should go to school and what they should do about their children with special needs, or they have questions about this, call your pediatrician, because they're willing to talk to you about this. We're there to help parents make the best decisions for their families as to what's in the best interest of their children and families.
Great, thanks very much. I want to ask both you, Dr. Goza, and Dr. Piercy. One concern is that we know a lot of parents are very anxious, so much so that some don't take their children to pediatricians for healthcare visits because they fear that there may be something at your office that could cause their children harm, that their children could become infected, that they could become infected. So how do we reach parents to let them know the facts about the importance of addressing health needs, with school being an important part of a child's health needs?
I think the key word that you just mentioned was facts. Because, like all of us, there are lots of different sources of information coming at us all day, every day. And we have to be able to parse through what is reliable and trusted information. And so giving parents those facts about not only the safety in getting back to a pediatrician's office, but the consequences of what can happen if one doesn't. It's been mentioned multiple times here already today, but I am deeply concerned about the decrease in immunization rates and the decrease in the amount of all patients, children and adults alike, presenting for typical health conditions. And so what we might find ourselves in is a situation where it would be even worse than just COVID alone. And so I believe that all starts with education. The AAP is an incredibly trusted partner in providing that, as is the CDC. And so that would be my key take-home message to parents, is find your news from a reputable source.
So at the AAP, like I said, we started our Call Your Pediatrician campaign. I hope y'all all saw the little panda who got his checkup. And we said, if the panda can get his checkup, your children need their checkups too. It's a very cute little video. But anyway, so we've been really working on this. I've been doing a lot of interviews telling parents, call your pediatrician, because we don't want children to have misdiagnoses. We want children to get their vaccines. And we are a safe source of information. But the American Academy of Pediatrics also has a parent website called healthychildren.org that has lots of information there about COVID-19. It has our school guidelines, school reopening guidelines on there. And so there's information there for parents as well. So I would encourage everybody, if they know anybody, say healthychildren.org is a great source of correct information for parents to access as well.
Great, thanks very much for that information. Dr. Redfield, can you comment on what we know about the epidemiology of this virus in terms of its effects on children and adolescents?
Well, I think first, I think it's important to realize that we do know this virus obviously infects all age groups. It's not clear to us yet, and as I mentioned, our household studies, the role that children play in the transmission cycle. For example, in our household studies so far, there was limited implications that the virus was brought into the household by a child. This would be different, say, than influenza, where it really drives the epidemic frequently, the children transmission in schools. But what we do know is that this virus also has probably one of the widest ranges of disease penetration, from totally asymptomatic, to mild symptoms, to symptoms to the point you go to the hospital, you have some pulmonary insufficiency, all the way to ICU and death. And so it's quite a spectrum of disease. And it does, I think when we looked at individuals under the age of 45, they represent 2.4% of all the deaths in this country. And when you look at them, those individuals under 45 frequently had a significant comorbidity, significant obesity, diabetes type 1. So this virus does seem to be very limited pathogenicity for children. Now there is an exception. There's a post-inflammatory syndrome that is very rare. There's several hundred cases that have been reported where it appears that the immune response to the virus causes a post-inflammatory syndrome and can be quite significant. And maybe our colleague wants to comment about it. But I think that's important, that really the individuals under the age of clearly 45 that don't have a significant comorbidity, that this virus has very limited pathogenicity. I would be remiss, since I may not get another question, just to ask the one thing that I do think it's important for me to be the advocate for all of you, is that this is the year to really promote influenza vaccination. And I think people know that I'm quite concerned about the fall and winter when we have these two respiratory pathogens emerging. And it can be very complicated, obviously, in the school setting if we all of a sudden have an epidemic of a respiratory illness. The only difference is flu is likely to be symptomatic in the children, all right? And of course, the COVID is likely to be asymptomatic. But this is the real year to try to really embrace vaccination with confidence, particularly for flu vaccine.
Dr. Goza, do you want to comment any further?
No, I think Dr. Redfield covered the post-inflammatory syndrome very well. It's still very rare, lots of more information to be learned about it as we go forward, but there are people looking at it very closely at the Academy and trying to figure out what we need to do.
Okay, great. And no worries, Dr. Redfield, I do have more questions for you. Dr. Piercy, Tennessee has many rural communities, and we know there are a lot of challenges to virtual learning. They may not have broadband access, but there are also transportation challenges for children going back to school. How's Tennessee addressing the issue of transportation in the reopening process?
Yes, ma'am, you bring up a good point that we have a very wide geography in Tennessee with a lot of diversity. We have rural counties that, believe it or not, are still in the single digits of case counts. We have metro areas that are exceeding 12,000. And so in Tennessee, we've learned that one size doesn't fit all. There are specific needs in our rural communities, like transportation, like technology. And so that's why it's been important for us to be able to work on the local level to individualize the response. Transportation is one of those things that a lot of our rural children rely upon. And so we have to be able to do that in a safe manner. Things like skipping seats or cohorting kids in seats that are in the same household. And we are also working with very practical tips for bus drivers. It's not practical for a bus driver to screen kids as they come onto the bus. And so whether that's an at-home attestation prior to getting on the bus, or whether that's screening immediately after departing the bus, those types of practical tips are ways that we're addressing transportation, for example. And that's something that our districts are looking for. They're looking for that very specific blocking and tackling day-to-day guidance that they need to be able to offer a safe environment for their children. And so in Tennessee, we've created toolkits, and toolkits from transportation to how do you do meals, how do you do choir and band, things that have been mentioned before. And then something that's very popular everywhere, but particularly in the South, how are we going to do football in the fall? And so these are the kind of things that we're looking at and working with our stakeholders every day.
Great, thanks very much. I have a couple of questions that I want to just pose to everybody and give everybody a chance to answer. The first was, I'm wondering if you all go out and you travel a lot, you talk to a lot of people. I'm wondering if you can describe an issue or a concern that someone brought to you in the process of considering school reopening that surprised you or concerned you because maybe it wasn't factually based. And I'm just wondering how you dealt with that.
Dr. Pearson? I can go first.
Okay.
Something that we have seen, and we've put it sort of on our best practices list, is there is a very rare instance when an entire district has to be closed. And I know that was the approach at the beginning, and it's been referenced earlier, these wide sweeping restrictions. But as we're going back to school, we really need to talk about an individualized and very specific approach. It may be that in the inevitable case that these infections come into schools, that you close a classroom, or you close a wing or a corridor, and perhaps the entire building. But that's something that we heard that it's an all or none on a district opening or closing, which is really not based in science and is certainly not the best way to educate all of the children across an entire district.
That's a great point. Thanks very much.
So I'll have to disagree. I haven't been traveling much since March. I've been in my office and in my home, and I have a little corner of my office that is now called my studio for when I get interview requests. But so I think one of the biggest questions I get from parents is, but what if they come home and we want to go visit the grandparents, and they've been exposed then, and how do we keep our grandparents and our family that may have health issues safe? And so I think that's a big question that's on the minds of a lot of parents, and just reassuring them that the schools will be safe, and that we will have that information, that if we do see COVID in the schools, that the parents will know about it, because I think they sometimes think that the schools keep it secret, so they don't want to let them know that they've been exposed. I don't think that ever happens, but that's kind of their thought process. And so reassuring parents that the school systems, the public health, and the pediatricians will all be working together to keep their children safe is very important.
Yeah, I have two maybe quick things. One is, I think one of the biggest challenges we're having right now is how to really communicate the message of the importance of social distancing, mask and hand hygiene to the millennials and Generation X individuals. I don't think we've been very successful in that. And, we've talked about it. I know when I call my children on the phone, I never get a response, but when I text them, they get back to me within about 5 minutes or less. I do think we need a strategy. I don't think we've hit home there. I don't think the younger group understands how important it is for them to fully participate in the social distancing. The other is that we talked about, that this isn't all or none. There's a lot of space in between, and I think we have to be more open to embracing those gray zones. And I think the one as a physician that's probably saddened me the most, and I've been involved in this, is individuals that are in end of life, and they've really been denied any access to their family members. There clearly is a safe way that those family members could have had access. When I see people dying talking to their parents on the phone, it really kind of bothers me. So I do think those are the two things that I think we as physicians and healthcare professionals, it's not black or white. There is a gray there, and we can find a safe way for that gray to take place.
Thanks very much. Those are very important points. I want to ask each of you to just comment about what we should be doing in an ongoing fashion. So we've talked a lot about the process of reopening schools and the importance of that, but what should we be doing to continually reassure parents, families, those that work in our schools, that the school is safe, even if there's a rise in cases in the community?
I think one of the lessons that we've learned, not only as it pertains to schools, but in the entire response, is to avoid extremes. And when everything is one way or the other, that doesn't lend itself to learning and to applying new learning about what we're finding out about this disease process. And what happens when one takes one extreme or the other is that when you get new information, you suddenly perpetuate mistrust. And we want parents to trust us, and we want parents to be able to rest safely or rest assured in that their children are going to be taken care of safely. And so I think transparency is a really important part of that. Transparency even about the uncertainty. I'm not sure anybody's got this completely figured out yet. And no school district has this completely figured out yet. And I guarantee there will be something that happens that's unexpected. And so communicating that transparency to parents and setting that realistic expectations of this is our plan right now, but we're in constant communication with our health officials, with our local leaders. We're looking at the data on a regular, almost daily basis and making those decisions sometimes on the fly. That's okay, because we want to be able to customize that approach to what's best for that school at that time. And so really communicating transparently and ensuring that everybody remains flexible in the process is really important.
I think that goes back to our saying that we have to be able to switch gears very quickly and be very nimble and flexible. We are learning about this disease. If we went back to what we said early in March, it's totally different than what we know now, or not totally different, but a lot different. And we've started doing guidelines instead of policies at the Academy related to COVID-19 because we do know that we need to review them very frequently because they are updated very often with the new data that we have. And so in letting parents know that we are watching that data, we are watching what's going on, we are going to be able to change as the information that we receive changes and the data changes.
Yeah, I think it's important. When I made my opening comments, I made the point is that we need to plan to open these schools with the understanding that COVID-19 is going to occur. I really think it's important to get ahead of the curve for schools and parents and teachers to kind of understand ahead of time how that school is going to respond when in fact they do get a case or a cluster of cases, as opposed to necessarily getting the storyboards going and overreacting and really starting going down a path. As you know, I mentioned that CDC did not recommend the schools be closed. But obviously the civil leaders made that decision. I'm not critical of it. I'm just saying from a public health point of view, we didn't see that schools needed to be closed generally. There may have been in certain schools that we saw should be closed because of outbreaks, just like we do for influenza. When it occurs, we shut down sporadically a school here and there to try to close the epidemic, or measles. But I do think getting ahead of the curve that you're talking about, how you're going to handle cases of COVID in the school when you diagnose them, so that doesn't become some type of 9 o'clock at night phone call tree that goes through the community, and the next thing you know, you have the school shut down for a week, rather than everyone being on board how we're going to handle this. I think that's really important.
Thanks very much. We have time for one last question, and that question is, for each of you, what would be the one key take-home message that you want people who hear this to get today?
So in addition to being a state health official, my more important role is I'm a mother of 4. I have one that's about to start college and then 3 in high school. And what I want to know is that my children are going to be safe. And I also want to know that I can trust those making the decisions, that they're going to take all of this into consideration when they're making these incredibly impactful decisions. It was mentioned earlier, but even those of us who have resources and have good coping skills, our children have struggled through this. And they don't, fortunately, have to worry about some of the other very serious social issues that some students do. So recognizing that this impacts all students, taking this approach to getting our kids safely back into school is probably one of the single most important things we can do to reopen our state, reopen our economy, and get on with our lives.
So just like our guidance says, we do believe that the goal should be for every state to have a goal of in-person school, but with those schools opening safely.
And I would just echo the most important thing from my point of view, from a public health point of view, from a risk versus risk point of view, that we need to reopen our schools. And we need to plan to keep our schools reopened. I think this really is the important message, and this is why we're having these discussions, to get people to understand that we need to reopen the schools. We can do this safely. We need to commit to it, and we need just to get it done.
Well, I'd like to thank all of our panelists for a really interesting and important discussion. And I hope that this will help our communities to think through the reopening of their schools and what that's going to entail. Thanks very much.
All right, folks. So that was the second panel when it comes to reopening American schools safely. The next panel is going to be where President Trump is going to be at with First Lady Melania Trump. So I believe that the First Lady is going to lead that panel, and President Trump is going to be there to deliver his speech. So just give me a second. I'll put the White House footage back up on your screen right now as we await for the next panel where President Trump and First Lady Melania Trump are going to be a part of, and we'll go on from there. Thank you so much for choosing Golden State Times as your stream of choice. If you liked our coverage so far, make sure to give it a thumbs up, and also please share this live stream on social media. All right, folks, you know what? Let's do it like this. Let's make it a little bit easier on all of us. When President Trump comes out, we'll be back online for that part of the speech. So if you are new to the channel, subscribe, click that notification bell. And once President Trump comes out, then we'll be back online and for his speech. So make sure that you are subscribed. Make sure the bell is on. If you haven't signed up to our our text message notification list, then all you have to do is text the word Trump Live to the number 555-888. So if you want to be part of our text notification list, then text the word Trump Live to the number 555-888. We'll be back online in just a few moments when President Trump comes out. So make sure you are subscribed, like I said, and the notification bell is on.